Okay. Good morning, everyone. And we're joining. Good morning, everybody. We are just, we have quite a few people who are joining us. And so our lobby is right now letting everybody in. So please bear with us for a few moments as we have everybody joining. And again, please bear with us. We do have a couple of people who are still joining the meeting, as we do have quite a few people who are interested in this board meeting. So we already are over 85 attendees. And so please give us just a moment. We want to make sure we can get everybody into the meeting. Okay, good morning, everyone. My name is Dr. Dominic Zerlo, and I prefer to be addressed as Dominic. And I'd like to welcome everybody to our first Medical Psilocybin Advisory Board meeting. It seems as though the people joining has slowed down a little bit, so we'll go ahead and get started. And hopefully that we'll be able to get through the agenda that we have and be able to get to public comment and actually be able to answer questions that people may have with regard to the board members themselves. Now, just to let everybody know, when we do get to the public comment, we will be taking comment, but we will not have time to answer questions during this meeting. We will be recording those questions because we want to make sure that everybody will have time to speak. And so we'll record those questions and then we'll publish an FAQ here in about a week, give or take a little bit, so that we can make sure we have answers for everyone. In the meantime, I would like to introduce Senator Jeffrey Steinborn, who is here joining us today and was one of the primary sponsors of Senate Bill 219. And so the floor is yours, Senator.
All right. Good morning, everybody. I hope folks can hear me okay. It is a real honor, and it's very humbling to be with you today and to get to help to kick things off. Thanks everybody who were able to join this morning. I am State Senator Jeff Steinborn. I was honored to be the lead sponsor of a bipartisan group of sponsors in the Senate, New Mexico Senate and House, who introduced the Medical Psilocybin Act. And I just want to say, to state the obvious, or maybe not, this is really a historic day, not just for the state, but really even for the whole country and the whole world, as we are experiencing a new renaissance, I'll say, because it's not the first one, but a new renaissance of psychedelic medicine. And as we know, New Mexico becomes only the third state in the country to create a formal public program for the use of this medicine. And recognizing the humility of this moment, I want to thank all of the advocates and practitioners who have been doing this work and advocating for this medicine for a very long time. In New Mexico and nationally, I want to thank those policy leaders who have been advocating for this medicine for a very long time, decades. And I want to thank, of course, and honor Indigenous communities who have been using this sacred plant medicine for thousands of years, whose knowledge and wisdom we are certainly learning from and drawing from and honoring as well. Finally, of course, I want to thank the Department of Health for standing up this program really in good time. Not just by government standards, by anybody's standards. They are really passionate about this mission, and that's obvious. And I think we can all feel really good about that. And lastly, I want to congratulate all the new advisory board members that have been appointed to this new endeavor. Congratulations to you, and thank you for taking this work on. I want everyone to know that the legislature fully supports this, stands behind you in this work to make this a successful program. And just kind of give you a little note of encouragement as you move forward, recognizing that we're only the third state to do this. By definition, we're pioneers, and we're going to learn a lot, but I also want to challenge you to not be afraid to try new things, to innovate, to make things better than maybe they've been in other states. In some cases, maybe they've gone down a road that hasn't been as fruitful that we need to deviate from. So I think we're going to be inclined to learn from them, but also let's build the very best thing we can build here, and never be afraid to use your voice to challenge that and to call for that. And others, of course, are looking to New Mexico right now to see how we do. And so this is not just as New Mexicans counting on you all to do good work and roll out a safe but also accessible program, but also how other states learn from that. So I look forward to supporting your work, and I congratulate you, and I really just am honored to be here with you all. And thank you, Dominic, for the opportunity to say a few words.
Thank you, Senator. We really appreciate you being here, and none of us would actually be here on this call without the work of you and your other colleagues in the New Mexico legislature. And so we really appreciate your being here, especially in this historic launching of the advisory board.
Thank you.
So just a few items from a housekeeping standpoint, so everybody is aware. Because this is the first meeting for the advisory board, some of the items on the agenda are to start looking at the bylaws for the advisory board, and as well as the beginning of discussion for electing a chair and a vice chair for the advisory board. However, until that occurs, I will act as a moderator for this meeting. Unless there are any objections with regard to from the board members. Okay, well, with that, we'll proceed. And again, what I really just wanted to go ahead and do, and for those who are joining late, my name is Dominic Zerlo, and I am the director for the Center for Medical Cannabis and Psilocybin. And just as a note, we are actually at this point over 110 people on this meeting at this point in time. So this is it's fantastic to see this many people participating, and we're going to try to do our best to be able to hear all of those individuals who are here for the public comment. But the first thing that we really wanted to be able to do is introduce our board members, our newly appointed board members. And for those who saw the link that I posted in the chat just a few moments ago, we do have the board members with a brief bio for each of them listed on our website at this point for the Psilocybin Advisory Board. And so if you go to that link that I posted, and I'll post it again here in just a moment, what you will see is the very first link there says, please meet the Medical Psilocybin Advisory Board members. And if you click on that, you'll be able to actually see their brief bios. But with that in mind, I'll go ahead and I'll start. If we could have Brenda Burgard. Brenda, if you could go ahead and unmute yourself and go ahead and introduce yourself.
Hello, everyone. Thank you for having me. I'm honored to be serving on the board here. I am an LPCC, art therapist, and licensed in addictions. I also been living in New Mexico for, about 48 years now, and love the culture here. And I want to help be able to serve here everyone and listen to everyone what they have to say, and help to form whatever we need to in order to move forward with this program, with the medical program with psilocybin. So thank you all for being here, and thank you for electing me to the board. Really appreciate it.
Thank you, Brenda. And Alana Dances, if you'll unmute yourself and introduce yourself.
Sure. Hi, I'm Alana Dances. I am, for the rest of today, the Chief Medical Officer of the Medicaid program, and I will be the Acting Medicaid Director starting on Monday. By a training, I'm a nurse practitioner specializing in geriatrics, and still practice a little bit seeing patients.
Thank you, Alana, and welcome. Next, Ian Dunn, if you'll go ahead and unmute and introduce yourself.
Hi, everyone. Thank you, Senator Steinborn, for creating this institution so that we can all be here. I want to thank the Department of Health for appointing me. My name is Ian Dunn. I am a nursing and psychology student at the University of New Mexico. I'm also a patient who has PTSD, a qualifying condition under this program. I hope to be able to advocate for my fellow trauma experienced people and to help bring them access to medications. Currently, we don't have a lot of good treatments for psychiatric ailments, and I hope that this will be one that we can provide.
Thank you, Ian. Desba, and if you can please unmute yourself and introduce yourself.
Ja, Asia e Desba na Kainishle no da than e Bashishina Kai Dashiche Asha International. My name is Desba. I was born in Santa Fe. I live here in Santa Fe. I have a background in geology, so that's my science background from Amherst College in Massachusetts. I grew up in northern New Mexico and around one of the highest overdoses for drug uses here in New Mexico. So I grew up around a lot of trauma and didn't realize until much later when I went away to college and had a hard time coming back and being back in New Mexico that how really much everything in our generations and our culture from genocide and so forth had really affected not only my upbringing, my culture's upbringing being Navajo, but especially also in northern New Mexico. Walking to the santuario, I was always told there's needles, you can't go to the playground because there's needles. And just how much that is something that we need to live through to survive. I'm also a licensed massage therapist currently practicing. Most currently, I am in the film industry as a storyteller. People have often asked me, how do all those three combine? The land tells stories, our people tell stories, our bodies tell stories, and so therefore I feel like I'm a storyteller. So I'm learning to combine all of these things, and it wasn't until I had my own family break about 10 or so years ago that I was introduced to the use of psilocybin and its beneficial therapeutic qualities. Since then, I have progressed on to working and doing meditations and how that has also helped, that it's not just about making that disconnection from the medicine with our brains, but it's also about doing the work. And I feel like this is an opportunity for New Mexico to do the work intentionally to move the rest of the country and the world forward. And what better place to do that than here in our own cultural sacred area. So thank you. I really appreciate the opportunity.
Thank you, Desba, and welcome. Dan Jennings, if you would unmute and introduce yourself.
Hi, everybody. I'm Dan Jennings. I am living in Hagerman. I've lived here all my whole life. We're about 900 people. We are outside of Roswell, New Mexico. So I serve as a town councilor here in Hagerman, and I run a nonprofit, Hagerman Forward, and work with 100% Chavez Initiative. And we're focused on 10 vital service sectors, including mental health. And through that work, I wrote the Opioid Solutions Grant Fund plan for the county and got that submitted. And so now we're working on utilizing the opioid settlement funds to actually work a lot in mental health. And a lot of my background comes from spending 20 years working for Department of Corrections here in New Mexico, Recidivism Reduction Bureau at the Roswell Correctional Center. And I have to say, I'm honored and humbled to be part of this group. I have to say I have a little bit of imposter syndrome right now because this is a fantastic group of people, and I'm just really excited to be part of this commission and hope I can make positive contributions and represent New Mexicans and in this quest to improve the lives of so many. And thank you.
Thank you, Dan, and welcome. And Larry Lehman, if you'll unmute and introduce yourself.
Great to be here. Thank you so much, Senator Steinborn, for the work of yourself and your colleagues and Dom and DOH. I'm a physician. I'm a family and addiction medicine physician. I've lived in New Mexico for 35 years, including 7 years working in the Zuni and Navajo reservations. I involved now really deeply in doing psychedelic research at the university. We're focusing on psilocybin and MDMA. I came to this from my experience of dealing with trauma, working as the Milagro medical director, dealing with trauma and pregnancy, and looking for ways that we could work on trauma and addiction. So that's my passion. I'm very interested in supporting us in developing a program that has a strong community basis, that has equitable access as well as safety. So delighted to be here with everybody. Thank you.
Thank you, Larry, and welcome. And Chris Piskuski, if you can unmute and introduce yourself.
Good morning, everybody. My name is Chris Piskuski. I'm a former staff sergeant in the Marines, and I'm an expert in substance use disorder, depression, and PTSD through lived experience. I was born in Cedro, New Mexico, and I reside here in Albuquerque. Currently, I'm working on becoming a facilitator in Colorado and just forming a deep connection with the medicine. And I'm an aspiring herbalist and a community advocate. And I'm just super grateful to be here among all of you, and really looking forward to getting to work on this and helping a lot of people.
Thank you, Chris, and welcome. So those are our 7 appointed board members at this point in time. And in order so that everybody on the meeting is aware of our team that we have here at the Department of Health, we'll go ahead and do some very brief introductions. So what I would ask is for my team members just to introduce yourselves, what your position is, and then we'll go ahead and move forward. I do have 2 people on our team that I will ask to say a little bit more towards the end. But in the meantime, if you will go ahead and introduce yourself, and we'll start with Brenda.
Good morning, everyone. Welcome. Happy to be here. My name is Brenda Martinez. I'm the Deputy Director with the Center for Psilocybin and Cannabis. Thank you.
Thank you, Brenda. Rosalie?
Hi, good morning, everyone. My name is Rosalie Nava. I am the Health Program Manager for the Health Education Team. Happy to be here. Excited to be a part of this.
Thank you, Rosalie. Raymond?
Good morning, everybody. My name is Raymond Gallegos. I'm the Systems and Data Analyst for medical cannabis and psilocybin.
Thank you, Raymond. Rosanna Archuleta?
Hi, everyone. Good morning. My name is Rosanna Archuleta, and I am the staff manager here for the Center for Medical Cannabis and Psilocybin. Welcome.
Kathy?
Morning, everyone. My name is Kathy Adjeri, and I'm an information technology project manager, and I support the Center for Medical Cannabis and Psilocybin. Welcome.
Katie?
Good morning, everybody. My name is Katie Freitag, and I'm a health educator with the program and delighted to be here.
Johnny? Oh, and just so everyone is aware, Johnny has actually been helping us as we have had people had requests to get into the meeting. It looks like he may be helping someone at the moment. So Johnny is actually our management analyst for the center and is helping us with, and Kathy with setting up the meetings and logistics for the program. And then the two people I'm going to ask to speak a little bit more is Rob Truckner. Rob, if you can introduce yourself a little bit.
Morning, everybody. I am thrilled to be here. It's starting now, isn't it? It's exciting. I am the medical director for psilocybin and for cannabis. My interests run from spore to the post-integrative sessions. So I have to say, I look forward to working with all of you, getting your insights and your perspectives so we can make one of the most effective yet safe programs in the nation. Thank you.
And the next person that I'd like to introduce themselves, but before I do that, I just want to let everybody know that this is Jorge Gonzalez, who is our new program manager for the medical psilocybin program, and is actually our first hire specifically dedicated for the program. So Jorge, if you'll introduce yourself.
Thank you, Dominic. Hello, everyone. My name is Jorge Gonzalez. It's good to see all of you here. Thank you for being here. This is Senator Steinborn said. This is this moment is huge for New Mexicans, and so thank you all for being here. And good to see you, and welcome to our guests who are also outside of New Mexico. My name is Jorge Gonzalez, as I said. Study here at the College of Santa Fe and the University of New Mexico. In community and regional planning, and also my work in social justice. My work around the state has been around youth development, community development, experiential education, social emotional learning. But I feel like my strengths are around networking and bringing people together. But as I see here, there's a lot of people here. And so I look forward to that. And I really believe that truly us being here as leaders is really important, that we listen to our local keepers of wisdom. And so I feel that moving forward in this moment that we be able to do that, listen to the keepers of wisdom and what our community needs, and then also that we have access to medicine, and we always keep that at the forefront, because we're gathered here and making sure that people's needs are met and that everyone has access to that. And I think that's really important, things that we keep in the forefront. And so thank you for being here, and look forward to listening to you all and to meeting with you.
Thank you, Jorge. And I just got a note that some people may not have heard in the very beginning, although you should have seen as you joined into the meeting, this meeting is being recorded. And so just to ensure people do know that they are being recorded, we will be putting the recording up on our website. It does take a few days for that to occur, but just in case people do miss portions of this, we will put the recording onto the website. So I just want to make sure everybody knows and understands that. So what I'm going to do now is I'm going to just share a little bit of information as far as the program itself. As you've heard, we have hired our first dedicated staff member in Jorge, our program manager. We do have 2 additional positions, which the postings for those just closed at the end of last week. And so we are just awaiting those lists from our Human Resources and State Personnel Office. And then we'll be starting to set up interviews for those 2 positions. Those positions are an environmental scientist and a compliance officer. And they will be very helpful and important in moving the program forward, especially with regard to setting up the rules and regulations along with the advisory board and working with various providers and potential cultivators as the program is being set up. Now, within the statute itself, it has been laid out that we have until December 2027 to get the program implemented. But as some of you may have heard on some of the other public meetings, because there has been such large interest in this and a push for us to try to be able to help people with psilocybin treatments earlier, we have set a goal now to have the program, at least to be able to see the initial patients by the end of December of 2026. So it's a full year earlier. And so we will go ahead and we will be doing our best to try to move the process forward. Now, that does not mean that all aspects of the program will be ready by that December 2026. And the one thing that I do ask is, starting up a program at any time is a monumental task. And we want to be sure that we're hearing information from people throughout the state. And so we'll be setting up various listening sessions and additional board meetings as things move forward, not just through virtual settings, but also in person for some of those. And so as we have more information, that will actually be posted onto the program website. And so with that in mind, if people are interested in getting updates with regard to the website, let me just share very quickly how individuals can do that. Give me just a moment and I'll share a couple of slides. Okay, I just want to check and make sure. Can people see the PowerPoint presentation? I see some thumbs up and some head nods. So if individuals are interested in getting updates on the program, we do have a method where you can do so electronically. And essentially it's to sign up for updates. There's just a few steps. First step is you'll want to visit www.nmhealth.org. Once you do that, you'll see in the upper right-hand corner of the screen a little indication, a link saying sign up for e-news. And you'll want to click on that link. Once you do, it'll take you to a page that has a little bit of sign up for e-news information. And you'll just want to complete that. And then once you've done that, then just click on the medical psilocybin box. You can also click on the other boxes that are there if you're interested in other information from the Department of Health. But you'll just want to click on that, confirm that you are not a robot, and click on the sign up button that is at the bottom there. And then you will be signed up for our e-updates. And we do send out information through those, including information about meetings, updates about the program as we move things forward. And we do also include job postings there in that through that process. So with that in mind, so the other update that I would like to provide with regard to the program is with the program, as we move things forward, our main staff and our main center staff are located in Santa Fe, but the staff for the psilocybin program, we are locating in Albuquerque. And the main reason for that is because it is a little more central for the state to be able to get out into the field, to be able to meet with community organizations, with various communities and with individuals, so that we can actually ensure that we are getting the information from the people that we need to get information in order to set up a great collaborative program. So with that, the review, our next item on the agenda is reviewing the purpose of the advisory board. Now, the purpose of the advisory board is set out within the statute. And essentially it is to review, recommend, and create medical conditions for individuals who may benefit from the medical use of psilocybin, to accept and review those positions, recommend additional patient qualifications, recommend formulation and preparation of dosage standards for psilocybin and treatment standards. Also, to be able to recommend and create the rules and regulations around the medical psilocybin program, and also to assist the department in establishing, monitoring, and determining the best ways to evaluate what is occurring for patients, with producers, clinicians, and with other parties that are involved with the program. And so those are the main duties and responsibilities of the board. And so what I'd actually like to do at this time is to show this is a draft of what we have actually created from a program standpoint, just to simply start for the advisory board itself, for them to be able to see what potential bylaws would look like. Now, for the members of the advisory board, we have put this into your SharePoint folder, which I know some of you have been starting to access and to look at. But I'm going to go ahead, pardon me, I'm going to go ahead and share it on screen so you get an idea. Now, we are not asking for you as a board to vote on this at this time. However, it is up to you to decide if you would like to do so, you may. However, what we usually recommend is that people review it and then make that decision and make those votes at their next meeting. So I just want to be sure that everyone can see at this point the document I'm showing that says Medical Psilocybin Advisory Board Procedures and Bylaws. Seeing head nods and thumbs up. Okay. And just to go over very briefly what is included in here, it lists down a little bit of what the statute provides for, including what the membership of the board entails. It includes then the board duties, which I just read a few moments ago, and then discusses what the membership and voting eligibility, which is essentially that a board member is someone appointed by the secretary, and that a quorum shall consist of attendance in the meeting by a majority of members. So that means that in order to be able to vote on items, then you would need to have a majority of people present to be able to vote. It does also have that if members miss 3 of the last consecutive board meetings, they may be asked to resign, because one of the things that in discussions with the secretary and with others, we do want to make sure that the board is going to be an active and involved board. We do understand that things happen sometimes in individuals' lives, but we do also want to make sure that we're able to move things forward. And that a majority vote consists of more than 50% of the voting members in attendance at a meeting, so long as there is quorum. That the meetings will be open to the public, so that all meetings of the board are going to be open. We will be recording them. And again, those recordings will be posted to the program website. And that the statute requires that the board meet at least twice a year. My only comment on that is that the board should probably be meeting more often than that, and especially here in the beginning stages, I would recommend that you meet much more often, but that is up to you as a board. All of the board meetings will be announced 7 days in advance, with the agenda posted 1 day prior. That again is something that you as the board members also have can decide. If you would like the board meetings posted sooner, and say, for example, at a 14-day, or if you think a 3-day notice is enough, that is up to you. And so what I would recommend is that the board have those discussions either here in a few minutes or at the next meeting before voting on it. And then again, with the agenda being posted, how soon or how much in advance of a meeting you would like that to be posted. And then, of course, that the meetings will be held at designated locations, whether that be in person or virtually, but to be done, that'll be indicated within the meeting announcement. The next step is actually the selection of a chair and vice chair, is that it'll be elected by a simple majority of the board members during a meeting. They're normally in that, because the secretary does actually appoint the board members, is with the approval of the Secretary of Health. I do see that one of the board members has gone in and done some editing. I think that's fantastic to be able to go in. So the other item is that the chair will conduct the meetings normally. And that the chair may also be removed by either a simple majority or a 2/3 majority in the meeting of the board, which the quorum is present. And again, that's a decision for the board to make on that. The vice chair will be elected by, again, a simple majority of the board members, and essentially following the same process as the chair, including potential removal if needed. And that the change of the bylaws is established by a vote of 2/3 quorum of the board, and that recommendations and actions that only members of the board may propose or vote on official actions of the board. Once the board has voted on the recommendations, then the medical psilocybin program staff will forward that to the secretary for their consideration. And we had put in a couple of different names for this next section because different people and different groups have different preferences for names, whether it be subcommittees, work groups, affinity groups, however the board would like to call them. That will be up to the board to determine, but that the board may create these subcommittees and designate chairs of them to explore specific issues through a majority vote of the board members. And that the committees should have specific tasks and can be disbanded by a majority of board members or when that specific task is completed. And then the committee report to the board the completion of that task. And then the usual and standard conflict of interest, essentially that the board members not have conflicts of interest. And if they do have one, they will bring that on up. And if necessary, if it is deemed to be a large conflict of interest, essentially to notify the Department of Health and to resign the position so that it can be filled with someone without a conflict. So at this point, I'd like to bring that on up and thank you to, I'm not sure which board member had gone in and done some edits, but I'm very grateful to see that. Oh, Ian, thank you. Very wonderful to see that and see you already jumping in since we only posted that to that SharePoint website last night. So I do appreciate people already diving in. But are there any questions, concerns, discussion from board members? Ian, go on ahead.
Yeah, so I just kind of wanted to explain. I made a couple of changes. One, I took out that for our chair and vice chair positions that we would need approval of the Secretary of Health. I figure it's an intra-organizational procedure to have a chair and a vice chair, and putting more work on the secretary would just boggle things down. So I struck that. Given, if you look at our current federal Congress, when you have just a simple majority control the chair of the House, nothing gets done. So I scratched the simple majority to a 2/3 majority to remove. And I followed those same rules to the vice chair, and then just named the ad hoc subcommittees just committees within the medical psilocybin board.
Thank you, Ian. Other board members? Alana?
Yeah, just as far as the conflict of interest, I think it needs to be a little more robust. I don't know if it's like as far as what are considered, like financial, how big financial, and I would also, oh, it does say affirm they have no financial conflicts of interest. I would also request that when there's public comment that people are disclosing any conflicts as well.
Alana, just to be sure I'm understanding you, you mean for the general public speaking during public comment? We usually do ask that individuals disclose their organizations during that time and who they're representing. But this really mostly affects and includes for the board members themselves. So, but that's a great point. And just so you know, we do usually do that as far as for public comments. So what I would like to recommend to the board is that you all review this through the rest of the the intervening period between now and when the next meeting is set up. And that if you do have edits that you go on in, go ahead and make those edits. We are able to track changes. Everything in that document will be tracked so that we'll be able to see if we need to revert back to, for example, a previous version, we can do so. So don't worry about breaking it from that standpoint. And then what I would recommend is that unless anyone have an objection, you have that discussion during that next meeting and vote on that. The one exception that I would say on that is if you all do decide to elect a chair during this meeting, which is actually the next item on the agenda, then that the board just agree that that would be a possibility to do. And if not, by the way, I'm happy to continue moderating for this meeting and allowing you all to elect a chair during the next meeting. But I'll let you all decide that. Any thoughts, concerns, questions?
Personally, for me, we've just gone over the bylaws as a whole, read through it with amendments, and we're allowed to propose any questions. I would say let's move to adoption, and then we can do the vote on the chair.
Chris?
Yeah, I would like time to review it further before we vote on it. That would be my position on it.
Yeah,
Other
me too.
thoughts? Okay. Despa, go ahead, Despa.
Yeah, I would say if it's possible to motion to table this until the next meeting to vote on approval of it and to then move on to the next agenda item, which would be to find a chair and vice chair. That would be my motion.
I'll second Despa.
I will third that a motion.
Okay, so just so that you're all clear, because we actually don't have bylaws yet, we don't have to do the motioning at this point in time. And this meeting really is mostly as an introduction and so that everybody can start considering the different ideas. But it sounds as though regardless, there is a majority towards reviewing it over the next time period and actually making decisions with regard to the bylaws in the next meeting. So unless there's any objections or if individuals want to discuss it more? No? Okay. So we'll go ahead and move forward with regard to selection of chair or vice chair. And this is really, again, this is up to you as individuals on the board to make the decision on it. And you do have the option to elect somebody for those two positions today, or again, just like with the bylaws, you can wait until next week with regard to that. And if you do decide to wait, I am happy to continue moderating. If you do decide to elect somebody, then we'll be moving forward with the other business and setting a next date before we move on to public comment. But so I'll open it on up to the board members.
I would be okay with voting for chair and vice chair, as that doesn't really set the rules too firmly. Or we can wait till the next. It depends on the majority, but I think it would be fine to do.
If that's the, oh, Dan?
I was just saying I'd be willing to go along with that as well to vote today.
Okay, well, if that is the case, then who would like to either nominate themselves or one of the other board members to be chair?
I'll nominate myself for the chair.
Okay. Ian? Others? Well, if there are no objections then, shall we proceed with Ian as the chair for the board?
Yes.
Seeing no objections, then how about the vice chair? Or would people like to think about that? Dan?
If I would be happy to be vice chair in case Ian would not be able to be at a meeting or so, if you would be okay with that.
I'll second him.
Okay. And I'm seeing thumbs ups. Do we have any objection of Dan being vice chair? Okay, at this point then, we do have Ian elected as chair and Dan as vice chair. And so with that, our next item of business is other business from the board. So.
I don't think the board has too much other business until we can establish those bylaws. That way we can get, committees started and that kind of thing. So until that, I think the only other business left on the table would be the next meeting date, unless anyone had some specific issues that they would like to address. I just feel the bylaws kind of have to have precedence over new items.
Absolutely, we can definitely do that. So it does come down then to how often, at least over the next month or two, the board would like to meet.
So we're all going into holiday season. I'm sure everyone on this board has obligations to attend to. I would say let's do the third Friday in January, which would be, my calendar doesn't want to load. 23rd of January, and we can do it at the same time if that works for everyone.
I would be concerned about setting a meeting during the legislative session.
Okay, yeah, we can definitely push it out. So can someone remind me, is it even numbered years or odd numbered years where it's a 60-day?
It's a 30-day this year.
Okay, yeah, then we can push it out to February.
Or just the week before.
We could do it before. That works too.
Like
We
the
need to be
16th.
Okay. January? Okay, that would work for me. Any objections? Okay, so January 16th at 9 a.m. works for everyone?
No, can I have a second? I feel like we need to be meeting more frequently than that. That's a month away before we can even get started on approving the bylaws. Can we not do that sooner?
I would
think,
propose moving up a
Chris-
week earlier. We have we have a really tight time frame to get if we're trying for 12 months.
Yeah, I would say that Chris has a really good point, and if there's a possibility that we can meet more frequently initially for a period of time, and then we can possibly move to maybe less frequently, depending on the needs of the board.
Yeah, I would totally concur with that. Let me break down kind of my understanding. So under the proposed draft bylaws that we have, it would allow for the creation of committees. What that would do would say that the whole board doesn't need to meet until a committee has come together and said, okay, well, here are the regulations that we support for production, let's say. And then they could come and we would have a big vote on it so that the whole board would be meeting a little bit less. If you do want to have more board meetings in the beginning, we can totally do that. It would just be pretty soon, probably like a week from today, if you guys wanted to do that.
Yeah, I agree. I agree to that. I could do that.
I could do that also. I would support meeting in a week or so and having one of the first areas to look at what the subcommittees could be, so then people could start applying to be on those committees and be thinking about. I think that would move us along a little quicker.
And I would like to recommend maybe, I know it's going to be difficult around the holidays, but maybe bi-weekly meetings after that. I think we need to be meeting much more frequently than once a month.
Okay. Yeah, and as soon as our bylaws are finished, we can definitely discuss the meeting amounts. But I would support a 2-week until we had most of the big issues that we are assigned under SB 219 settled, especially with, that shortened time frame, right? We want to get it done by December 26th. So I would have no objection to every 2 weeks a meeting. So we're going to do a week from today, and then we can set the next meeting at that meeting.
So that would be the 11th at 9 o'clock, December 11th,
December 12th.
December
week from
12th.
today.
Oh, that's a Saturday.
December
Right?
12th
No,
is a
no.
Friday.
Oh, I'm looking at 2026. I'm so far ahead. Okay.
Getting ahead of me
Okay,
now.
right. Right, okay. See, I'm already on top of it here. All right, great. That sounds good.
All right, perfect. Well, December 12th at 9 a.m. will be the next meeting. Is there any other issues we want to address? Any motions on the table?
Will we be meeting in person or online, or would it be a hybrid?
I'm going to defer to Dominic. Do you have a preference on how we meet?
I would just recommend, due to winter weather conditions, that we conduct the first few meetings virtually, just because otherwise we may run into this situation of people not being able to travel or trying to travel and being, exposed to unsafe conditions. So I would just recommend doing the next ones virtually, the next couple. And what we'll do on the program side is for next Friday at 9 a.m., we will get that notice out as soon as possible, including with the links for it. And I do apologize for the change in my view. My computer decided to restart right a minute ago, and so I'm waiting for it to come back on up. But in the meantime, as you can see, always having another option available. And so I am on my phone at the moment. My apologies if people cannot hear me quite as well.
All right. And then I believe the last thing then we had to get to, so we'll be doing it online. Will the Department of Health be providing the Teams link and stuff, how they kind of did this time?
Yes, we will. We will get
Perfect.
that out later today, and we'll get an announcement out as well. The announcement may take a couple of days because we do have to run it through our IT, and they always review items. So it may take a couple of days for that announcement. But since we are announcing it here, it will be a public meeting. We will send it out through those e-updates that I mentioned earlier. And then once my computer is back up, I'll also show that information again on how people can sign up for the e-updates.
Will it be a 2-hour meeting again?
That is up to you all.
And then Chris had a question.
Just to finish, since I brought up, I'm fine with the 2-hour meeting. I just wanted to have it clear so we put it on our calendars. How do others feel about 2 hours?
Is there a good way to communicate with each other in the interim? Do we just post on the SharePoint page, or how does that work?
Chris, what we will go ahead and do is we can go ahead and connect each of you through email so that if you want to communicate, you can do so. The one thing that I do want to caution everyone on from a transparency standpoint is that any communications among board members are subject and are open to the public. And so just to let you know, that would be the case. But we can definitely set that on up so that you all can communicate through other means as well.
Alrighty, and then is everyone ready for public comment?
Okay. And Kathy, if I may, Kathy, do you have the list ready for the individuals who'd signed up?
I do, and so we'll start with those that had requested to provide public comment when they registered for the meeting. And then by using the hand raising button in the meeting, you will be able to raise your hand if you did not register ahead of time but wish to provide public comment. So situated here with the timer. Just as a reminder, each person will have 3 minutes, and we will allow for you to, I guess, speak again if there's additional time remaining in the meeting. But we'll go through everyone as a first pass first, and then if you would like to speak again, we'll kind of go through that process again. Does that make sense? Okay, so let me get the first person. Is, sorry, the list is so long, I have to expand it. Okay, so the first person is Denali Wilson. Denali, your mic is activated. If you would unmute, you have 3 minutes.
Good morning to the department and members of the advisory board. My name is Denali Wilson, and I serve as the New Mexico Director of Strategic Support for the Healing Advocacy Fund, which is a nonprofit committed to expanding and protecting safe, affordable, and equitable access to psychedelic healing for all who need it. I want to first just express our gratitude. Thank you to all of the advisory members for volunteering your time and your expertise to help New Mexico build a care system that meets the needs of people struggling to find relief from their suffering. Our state is poised to lead the country in the integration of psychedelic therapy and our existing healthcare system. And while it is important for the program to move forward with urgency, achieving the right balance of safety, affordability, and equity will require careful attention and thoughtfulness. And so let's be sure that any acceleration of the regulatory timeline doesn't unintentionally compromise patient safety, undermine long-term sustainability, or limit meaningful public engagement. But whatever timeline the department ultimately adopts, we will remain fully engaged and offer recommendations on the key parameters that will shape how the care is delivered in New Mexico. I want to briefly revisit a few priorities that we've raised previously during the department's listening session over the summer. First is safety. We support balanced patient safety guardrails, tiered and tailored licensing and training requirements so that care team members receive the training unique and appropriate for their role, a clear code of ethics, and strong systems for measuring outcomes, both in terms of reporting adverse events and comprehensively capturing the overall program impact so that we can protect patients and have what we need to continually improve. We also want to see affordability and equity prioritized. We want to urge the full funding of the program's equity fund and are ready to support the department's upcoming budget request in the legislative session to move in this direction, with an earlier timeline being discussed that pulls services in as early as next year. The equity fund must be prioritized in 2026 so that patients can access services that we're building together. Also on affordability, we really encourage regulations that keep care affordable, things like allowing
30 seconds remaining.
group care models, adopting a broad definition of clinician within the rules, authorizing diverse care settings and care teams, including peer support workers and traditional healers, and ultimately working to ensure that the cost of this care can, as much as possible, be covered by Medicaid and private payers, private health insurance. Thank you so much for your time and your leadership, and that's all I have.
Thank you.
Thank you.
Okay, next we go to Scott Kennan. Scott, your line has been activated. Please unmute. You have 3 minutes.
Yeah, thank you. Well, I'll just say I'm originally from Tennessee, came over here to New Mexico, and I love it. I left there because I didn't agree with a lot of things that were going on. I'm currently on the maximum dose of 2 different antidepressants, but I still have a lot of haunting, terrible thoughts due to PTSD and depression. I'm one of those people that you hear about. I've had a terrible life from day one. Actually, even before I was born, I was exposed to drugs and trauma. It still affects me greatly. I almost drank myself to death for 20 years. I got head injuries and all that kind of stuff while I was doing that. I stopped drinking 8 years ago, but I still have the effects of the depression and the PTSD. I think my brain is damaged. This sounds like something that really could help me. I don't know. I'm always looking for some kind of magic pill to take it away. These aren't magic pills, they're magic mushrooms, but I know it's not really magic, but I'm also interested if I know you don't have time to answer any questions, but I would like to know about how psilocybin would be administered. Would it be a pill or a patch? Um, I've heard that the mushrooms actually taste terrible if you try to eat them. That's why I'm asking. I would go through that anyway, but um, yeah, I'm just curious about that. And also, um, I'm curious about how the process would work. I have a therapist here in Silver City whom I trust, sort of. I don't trust much of anybody, but with her over the past 7 years, I've learned to trust her a little bit. Um, I don't know if I could go to another city somewhere and meet somebody that I've never met before and trust them to guide me through the process with this psilocybin. So those are just things I'm curious about. And I thought I'd tell you a little bit of my story and how I'm very much looking forward to uh, psilocybin treatment if it actually does come into place. So thank you.
Thank you. Okay, next we have Brett Phelps. Your mic has been activated. Please unmute yourself. You have 3 minutes.
Kathy, Brett actually posted in the chat that he was not going to provide public comment at this time.
Okay, thank you. Okay, we'll go to next was Greg Evans. Greg, your mic has been activated. Please unmute yourself. You have
Hi,
3 minutes.
Thank you for allowing me to speak. My name is Gregory Evans. Is my mic working?
Yes, we hear you.
Cool, thank you. Yes, I am interested in contributing in any way that I can to the development of this program, whether it be through a committee or working directly for the Department of Health. I have an application in for the Senior Compliance Officer position that is available, and I'm look forward to being able to talk with you guys more directly about that in the future. Currently, I work in compliance and grant management at the Department of Public Safety. And I feel that my personal interest in making sure that we move into a system where compliance tracking for growth, testing, and analytics merges well with the system of physicians and caregivers, so that dosage and understanding questions like the previous commenter was asking can be communicated in an accessible manner to the public. I feel that finding a way to reach the demographics that would not normally know that they can benefit from this medicine is essential. And I'll just kind of like leave it there for today. And also congratulations. I am so proud that so many of you have been able to show up for this. And I am really excited about the choices that we've made for the board members here today. Thank you.
Thank you. Okay, next we'll go to Lida Fatemi. Your mic has been activated. Please unmute yourself. You have 3 minutes.
Good morning, everybody. Thank you so much for having me today, and thank you for your presence and the beautiful work you're doing for our community. Congratulations to the advisory board members and our state, really, as a pioneer. My comment is, kind of goes off of what Denali mentioned about safety of our community, which then really begets that we need a lot of education for those who will be utilizing this as medicine for its extensive therapeutic benefits, and to learn from other states such as Colorado and Oregon for the unfortunate complexities that they have created for facilitators and care delivery to occur, and to make it less complicated. I'm in the world of medicine. I'm a physician, hospice physician, and worked at UNM for a decade as a hospitalist, academic hospitalist. And though I enjoyed it, learned a lot, but the complexities that we have in the medical industry really creates so many complex obstacles for proper care delivery to patients. If I want to help a patient with chronic pain, it is nearly impossible to do so. And it brings them to tears. It breaks my heart. And so for us to really be aware of that when we are making these rules and regs moving forward, so that those who really need help are able to get it where they need to get it, even location-wise. Those with disabilities, those at the end of life who can't leave home, they should be able to get these medicines at home. So I think we have an incredible opportunity right now as leaders and pioneers. This is uncharted territory in some ways, uncharted in some other ways, and for us to be creative in how we can really bring these healing modalities into our community with good common sense and practicality as well. Thank you so much for having me.
Thank you. Next, we will go to Aliyah Dowdy. Your mic has been activated. Please unmute. You have 3 minutes. Aliyah, your mic should be activated. Okay, we will move to the next one. Next, we'll call on Adele Getty. Adele, your mic has been activated. Please unmute. You have 3 minutes.
Well, thank all of you so much. I actually said that I was not going to make any public comments, but thank you so much for all of you who are participating in this and have volunteered. And uh, I guess one of the things that I would say is, as Limina Foundation, and you know, we put on the Enchanted State earlier in September. One of the ideas that we've had is to be able to make a very short educational film as a result of that event, that could be, you know, used both online and taken into, you know, rural parts of New Mexico as an educational, you know, opportunity for people who may have no idea about what psilocybin, many people cannot even pronounce the word psilocybin, and for them to understand, you know, the importance and the positive effect that you know, these, you know, medicines can have inside our communities at large. So we're in the beginning stages of that. We did film it with 3 different cameras, and we think that there's a real opportunity there as an educational event. So thank you.
Thank you.
And
Okay,
Kathy,
we'll come back to
Kathy,
Aaliyah. Aaliyah, your mic is activated. Please unmute. You have 3 minutes. Aaliyah? Hello?
Hello, can you hear me?
Yes.
Oh, okay, finally. I couldn't get it to unmute. Sorry about that. My name is Aaliyah Doty. I'm a licensed doctor of Oriental medicine and also a biodynamic craniosacral therapist. And I'm starting to train in somatic experiencing work. I've been doing a fair amount of research on medical use of psychedelics, especially psilocybin, and I work with trauma healing and with 5-element acupuncture and the craniosacral therapy. And I really, really want to be working in this field of holistic medical use of psilocybin, and also interested in helping bring forward in whatever way possible this program in New Mexico for as many people as possible in a really safe, supported way. So I'm really excited about this program, and I want to be able to use this in my practice. And so, you know, I don't know what the regulations are going to be on who can work with us. But I just want to have input on that. And I also want to mention Paul Stamets, who's a famous mycologist from Washington. And he's done a lot of research on medical use of psilocybin. And so I encourage people on the board to look into, you know, check into him and look into the research that he's participated in. Could you hear me okay?
Yes.
Okay, great. That's all I have to say. Thank you.
Okay, thank you. Okay, next we have Ash Shelton. I see an Ash in the participants list. I'm disabling or allowing the mic. Please unmute yourself. You have 3 minutes.
I actually wasn't going to make a comment, just kind of listening in to see what's going on and how things are going. But I am a mushroom farmer, so I'm here just kind of seeing how things are going to move forward, seeing how what I do would be implemented or used, or what opportunities would be there for local farmers and to let us be part of this. And that's basically it right now.
Okay, thank you.
Thank you.
Okay. Next on the list was Anna Vendrelli, but I don't see her in the meeting. So we'll go to the next person was Catherine Warnock, but let me check the chat. I think I saw that she said she wasn't going to give comment. Nope, that was a different Catherine. Go ahead to Catherine Warnock. Your mic has been activated. Please unmute yourself. You have 3 minutes.
Can you hear me?
Yes.
Okay, excellent. Sorry, that took me a second. All right. So thank you to all of you that are donating your time and energy towards this remarkable project. And thank you for the opportunity to speak today. My name is Catherine Warnock, and I'm a licensed professional counselor and psilocybin-assisted therapist in Las Cruces. As New Mexico builds this program, affordability must remain a central focus. We've seen what happened to Oregon and Colorado, where training requirements and licensing fees have created insurmountable barriers. Some practitioners faced costs of over $10,000, which pushed entire communities out of participation, especially rural providers, culturally rooted healers, and those serving marginalized populations. If we're not careful, we risk creating a program that only the wealthy can enter and only the wealthy can access. New Mexico has an opportunity to do this differently. We can build a system that is ethical, accessible, and grounded in harm reduction, not one that recreates the same inequities we have seen in the rest of healthcare. Affordability is also a safety issue. When training is inaccessible, the people most deeply connected to their communities, Indigenous healers, traditional practitioners, curanderas, counselors, peer support workers, they are excluded. These are providers who often have the strongest relationships with the people who need the medicine the most. I also want to highlight another essential component, the value of firsthand therapeutic understanding of psilocybin-assisted therapy. This medicine cannot be fully understood from theoretical understanding and policy alone. The nuances of set and setting, emotional pacing, trauma activation, somatic response, and integration become clear in a way that research articles can't capture. If any board member or working group participant has not yet had the opportunity to experience psilocybin-assisted therapy within a safe, guided therapeutic context, I encourage creating space for that. Whether through established facilitators, training organizations, or approved community pathways. These experiences consistently lead to more grounded, compassionate, and effective regulation. New Mexico has the chance to build a model that is safe, affordable, culturally respectful, and community-driven, one that recognizes the wisdom already present in our state and center our state
You have
and
30
centers
seconds remaining.
harm reduction as the guiding principle. I would also like to comment on something a previous commenter addressed. I do think it would be a great offering if we could have a program in which non-psychedelic therapists can attend treatment with their clients to ensure they receive a full experience of care and trust. And then finally, I just want to again thank everybody for all the time that they've put into this. I think it's really important, the work that's being done. Thank you for your time and commitment to this process.
Thank you. Okay, next, as a registered requester to provide public comment on the list was Jen Clemente. Confirm.
Kathy, Jen
Yes, she
has
said
said that
yeah, sorry,
no
it's
comment at
there's
this time.
okay. Yeah, sorry, but between the chat and the two different lists, it's a lot. Okay, let's see. And then next was Gary Chavez, but I think I didn't see them in the list. Gary is here, yes. Okay. Gary, your mic has been activated. Please unmute. You have 3 minutes.
Hi, thank you. Can you hear me okay there?
We can, thank you.
Awesome. Thank you all for having this group come together. It's really been inspiring to see this kind of take fold in the amount of time that it has. I am coming more from a personal experience through this process. I have been involved in the medical cannabis program since 2011, just really looking at different avenues for whether it was PTSD or cancer or different elements that I personally have gone through through these struggles. And so what's really fascinating for me on this aspect is how can we look at the newest avenue that I really took about 5 years ago was just dealing with my alcoholism. And so I wear many hats, and so for this specific you know point that I'd like to get to is I tried multiple different avenues. Psychedelics is the term we use. Entheogen is the preferred term that I can grasp towards and share with folks. That's helped me through this pathway. So going through that, being 5 years sober, recently getting off of nicotine, about 9 months free from that. Psilocybin has been my biggest advocate through and through. I both have experienced a macro dose, as it's called, a hero dose, as folks like to deem it, down to micro, and just trying different pathways for myself to heal. And so, in any way that I could be an advocate for this program, I'd love to see what I can do to help the community, those that are on the streets that are dealing with mental illness, up to, we have this big push and balance from those that have the money. And so it is important that there's no distinguishability for me on a mental state. We all struggle with it, whether you have money or don't have money. I think that what people have touched on about this is it needs to be accessible, and that's my big push that I'd love to see, because I've been gifted these fruits, if you would, the magic mushrooms, for free. I've allocated them through the
You have 30
illicit
seconds
market.
remaining.
And so in any way possible that I could help advocate and push forth in a way that people can have access to this medicine, I'd like to just do my part. And I really hope that the committee here, the board, I appreciate your time that could happen. So thank you.